and I did a bit of yoga, and I initiated some early steps toward looking after myself the best way I can. But I didn't have an entirely wholesome experience, shall we say, with the public system. I had private health insurance, and I was lucky that I had private health insurance, but it still took me a couple of years I should say, to find out where to go to see a pain management specialist. In 2009, maybe it was a relatively new pain discipline or specialist discipline, I don't know. I didn't know anything about pain specialists back then. My GP said to me, you need to go and see an orthopod or a neurosurgeon or somebody like that. And they had a look at the scans and said, can't see anything, it must be somatic, go away. So I started to learn a little bit more about my condition, and I went to an anaesthetist in 2012 who has become a pain specialist. I'm not going to mention any names, he's not here, are you? No, he did a good job. He did 9 radio frequency treatments for me. Yes, 9. They were effective. The nerve ablations in 2012 and 13. I had a couple each year. And then I did a couple more in 14 and 15, which were less successful and didn't provide the pain relief and the neuropathy cure that I thought it might be. So we stopped doing radio frequency in 2015. Around that time, my mobility became a problem, and I went to part-time work, and eventually I had to leave my occupation. I'm an ex-registered nurse 25 years ago, and at the time I was working in the occupational health field, driving up and down the coast of Queensland. But I can no longer drive, and I'm pretty good at walking if you give me a rest every 200 metres. So that was my story until my occupation ended. So the barriers for me, and there were quite a few barriers along the way, and I think I'm fairly good at advocating for myself now, but along the way, my main issue was knowledge. I didn't know what I didn't know. And I had to research, read, and get some health literacy. So maybe that's a problem for other patients as well, getting up to speed with what's out there and educating yourself, because nobody else is going to, frankly. Number 2, I've already mentioned, I had private health insurance. That was fortunate for me, but I must say that pain management courses are very expensive, and I haven't attended one under the private system where they admit you for a week or 2. I can't afford it. But I did get into a public pain management course, and that was through Metro South, and I'm sure they're good people, I know they are, but it took 8 years, and that was me. I didn't get in until 2017, and by then I could actually stand up here and talk to the patients who are just entering their pain journey, most of them, and probably give them information that I already knew, because I was well informed 8 years later. So there are waiting periods involved, and of course there's a hierarchy of needs, triage, and my lower back condition, which has been proved to be facet disease, osteoarthritis in the lumbar region with neuropathy, numb leg, the whole works, I've got it all. But that diagnosis came in 2012. So 2 things there. My diagnosis took 3 years, and it took me 8 years to see a pain clinic. That's my situation. Other people may be more fortunate or less fortunate. And because I live in an urban area, I'm very fortunate because I could get in, and the transport that I had at the time enabled me to get in. Some people have to travel hours to see a GP in the rural areas. We all know this. You probably spoke about it this morning. Waiting periods, doctors versus CBD versus rural areas. There's a big difference. And I'm also lucky that my age and overall health status prior to the injury was pretty good. I didn't have any other comorbidities, as they say in the business. The other thing I wanted to talk about, just as part of a barrier for me, was actually getting access to allied health. For example, physio, hydro, acupuncture, etc. I found a lot of trouble initially getting into that, and it costs money that I didn't have when I stopped working full time. And it wasn't until last year that I stopped living off my own savings, and Centrelink were kind enough to give me some money. So yeah, it was very difficult for me to afford the allied health, and my GP at the time did not offer to me an enhanced primary care. I didn't know about that. I had to go and read and show them and say, can you give me these 5 visits a year to see the physio? Wonderful. Oh yes, of course, we can do that. But that was all used up in 5 weeks. So my question is, if you're seeing someone getting enhanced primary care, or you're doing the mental health care plan for 10 visits, sure, that's okay, but you might have used it up within a couple of months, and frankly, I can't afford the other 9 to 10 months of the year. So my question, one of my philosophical questions today, is why do chronic pain patients not get more enhanced primary care options, funding from the government, particularly if they're on Centrelink? Sure, if you're earning $1 million a year, who wouldn't want that? Yeah, I can afford it then, but I can't. So yeah, in summary, 12 years down the track, I'm a lot better. I self-manage. I'm my own advocate. And my doctor and I talk to each other as equals. And that's fabulous. She's a great doctor, a GP. And I see a specialist once a year. But yeah, in summary, my current pain management toolkit involves many things. It's not just one size fits all. And that's another point which you've probably heard today, but I might leave you with later on. One size fits all. That's what I heard a lot when I first started. You must do this, you must do that. But why can't I do that and all of these things? So for me, my current plan involves pain medication, very important, meditation, mindfulness, acceptance and commitment therapy. I see a clinical psychologist when I need to, cognitive behavioural therapy, distraction, the most important one for me, keep busy. Medical cannabis, I could talk all day about how valuable medicinal cannabis has been to me since I started on it 18 months ago. Before that, I was on a lot of endone and short-term breakthrough pain. I no longer have to take short-term breakthrough pain relief, such as endone, which I couldn't sleep on, haven't slept for years until recently, and it was great to have that option of the medicinal cannabis. I'm on a slow-release opioid these days, which I've been on for 6 years, haven't changed. What else was important for me? Sleep. Getting a normal sleep routine, giving up alcohol, yahoo, and also an anti-inflammatory diet, a gluten-free diet. Pacing is one of the most important things as well. I can operate for 2 to 4 hours a day now, not 12 hours a day in a busy job. But pacing is what I do, and I think I do it well. Knowledge is power. As I said before, self-advocacy has been my big breakthrough for me, and getting access to multimodal care. Affordable treatment, well, it's not always affordable for everybody. Maybe we need additional funding somewhere. What I wanted to end with was actually just a little bit of a question. I'm sure it's been asked today already, and it's a little bit about pain medication. I mentioned before that I use a very low-dose, slow-release opioid, and I was very interested when the opioid reforms came in June of 2020 last year. I actually read a lot about the World Health Organization and how they've classified just recently chronic pain or chronic disease processes as a legitimate illness now, and they've got multiple categories. But I'm very interested in the difference between chronic primary pain, which is something that has no underlying cause, and chronic secondary pain, which is what apparently I have now. I've got an underlying cause. At the beginning of my presentation, I mentioned diagnosis. It took 3 years for me to get diagnosed. And during that time, some things happened which probably shouldn't have with treatment that was given. And when I got a diagnosis, it was a big relief. So I just wanted to say diagnosis for me and self-advocacy has been important. And I now can advocate for myself and say, yes, I believe I do need some painkillers. I've tried all the antidepressants, gabapentinoids, antipsychotics, and all the other ones that are used off-label. And they all had terrible side effects for me, with clearness of head. And because I don't have, I believe, an addictive personality, I haven't actually been lectured to by my GP about the harms of opioids. I know that as a registered nurse. I know to take them as a registered nurse. I know to take them as prescribed, and that's what I do. So basically my time is nearly up, and I just wanted to talk finally about the lack of pain specialists. And I'm sure we all know this, but I was reading recently from Associate Professor Malcolm Hogg some research he did twice actually, once in 2012, and he revisited with another article in 2020. And he said that persistent pain management services are currently unable to meet service requirements. That was in 2012. And then in 2020, he returned to that theme, and he said that the range and wait times still remains diverse, extending to 3 years beyond in some areas. Pain Australia say there are 3.37 million people with chronic pain in Australia. And I also read something from APMA, our organisation, or one I belong to as a member, which said that there's one pain specialist for every 21,000 people. I didn't know that when I first started 12 years ago. Maybe the figures were higher then, and they're better now. So again, I thank everybody for coming today and listening to my story. And I'll just end by saying one more thing, if I may. When I Googled pain management stewardship yesterday to find out what it was, I knew already, but I thought I'd Google. I Googled, and all I kept getting as a Google hit was National Opioid Analgesic Stewardship Program, Australian Commission on Safety and Quality in Healthcare. Apparently we're supposed to be monitoring opioids with e-script or Q-script or whatever state it's called now in its form. And I often wonder, why aren't we concentrating on benzodiazepines, alcohol? I've read the Pennington report. People are saying, what's that? Well, the Pennington report was given to the ABS for stats about overdoses, and multiple toxicities was where or polypharmacy is where all the overdoses have occurred. I cannot find any written articles anywhere, please correct me if I'm wrong, which identifies exactly how many people overdosed on opioids alone. Legal prescription opioids, not illicit ones that are in America. 80% of Americans die from overdoses from illicit sources. We don't have that problem with fentanyl yet in Australia. So that's what I'll leave you with. What is pain management stewardship? It's me advocating for me with the team of my choice. No one size fits all. I thank you so much.